We had discussed action potential, resting membrane potential, electrotronic potential. We have differentiated between action potential and electrotronic potential, and we had also discussed what? Cardiac action potential, right? And in heart there are two different types of tissues. One is conduction tissues, another is myocardium. Okay, in conduction tissues we have seen the shape and size of action potential, which is seen in SA node, AV node, bundle of E's, Purkinje fibers, right? And we call them slow response action potential. And we have also discussed the ionic basis of action potential in the conduction tissues, and also the ionic basis of action potential in myocardium, which is called the fast response action potential, right? So two different types of action potential we have already discussed. And you by now you should have the preliminary concept that once a single cardiac cell, cardiac muscle cell is depolarized, the action potential travels through the gap junction from one cardiac cell to another cell, right? And the whole heart is depolarized. Okay, so suppose this lecture hall is left ventricle, right? So one cell of left ventricle, say for example one brick in the wall, if it is depolarized, then all the bricks are depolarized within a fraction of second, right? And the left ventricle contracts, right? Once the whole ventricle is depolarized, the ventricle contracts and ejects blood into the systemic circulation, right? This is the mechanism. Now, after being depolarized, all the cell will again repolarize and back to resting membrane potential, right? So, depolarization followed by repolarization and coming back to resting membrane potential. So, during this repolarization process, heart relaxes and blood comes into the ventricle, correct? So, for heart to contract, what is the basic requirement? Depolarization, right? For the heart to relax, what is the basic requirement? Repolarization, right? Depolarization means just change in the polarity. Normally, in a healthy cell, in a resting cell, inside is negative in respect to the exterior. Once it is reversed, we call it depolarized. Okay. Now, from the depolarized state to again resting membrane potential, this process is called repolarization, right? So, heart को contract करने के लिए पहले इसको depolarize करना पड़ेगा, right? And heart को relax करने के लिए इसको repolarize करना पड़ेगा. Okay, depolarization, contraction, repolarization, relaxation, right? Okay. And this depolarization from one cell to another cell, depolarization process from one single cardiac myocyte to the adjacent cardiomyocyte, this takes place through a specific structure which is called gap junctions, right? And gap junctions is made by, you already know, gap junctions is made by proteins called connexins, right? 6 connexin protein contributed by one cell and 6 connexin protein contributed by another cell, and the tunnel is made, right? Okay. Now, due to this gap junction, this depolarization process is faster than what we assume, right? This depolarization process is faster from one cell to another cell because of the presence of numerous gap junctions between two cardiac cells, two adjacent cardiac muscle cells, right? And if you consider the conduction tissues, even the gap junction, the density of these gap junctions are even more. So, through the conduction tissues from SA node to AV node to bundle of E's to the Purkinje fibers, left bundle branch, right bundle branch. Okay, through this route, action potential travels even faster due to presence of dense gap junctions, right? Okay, so gap junctions is the basis of transmission of action potential from one cell to another cell, one cardiac cell to another cell, and finally, this is the major mechanism. This is the only and major mechanism for the depolarization, complete depolarization of heart. Okay. Okay, now as action potential is traveling from one cell to another, there is flow of electricity, right? There is flow of electricity in a particular direction, and you know that the point of generation of action potential is your SA node, which has got the pacemaker potential, right? Where there is no fixed resting membrane potential. Resting membrane potential usually fluctuates between minus 40 to minus 60 millivolt, right? And it automatically takes to firing level, threshold potential, and it fires. So this is the property, inherent property of pacemaker cells like SA node, and this is due to presence of a specific ion channel which is called funny channel, and the another name is HCN channel, or hyperpolarization gated cyclic nucleotide activated ion channel, which is a non-specific cation channel. And we have also given examples of few drugs which blocks this funny channel, and which we use in a patient of heart failure or in a patient of myocardial infarction to reduce the oxygen load, to reduce the load on heart, right? Okay, we have also given the name of that drug, ivabradine, right? Okay, now I will introduce one term to you, that is cardiac vector. Okay, so in cardiography, in cardiography, electrocardiography, the basic need is to know the cardiac vectors. Okay, so a depolarization wave, when action potential is traveling through heart from one cell to another, we call it depolarization wave. Simply, it is a flow of action potential from one cell to another. We are calling it depolarization wave. And obviously, this depolarization wave is starting from SA node located at right atria, right? So this depolarization wave originating from SA node is moving from one cell to another, and gradually it is moving towards the ventricle, right? Gradually it is moving towards the ventricle. And in vector cardiography, these depolarization waves are behaving like a vector, which has got a direction and it has got a magnitude, just like the vectors what you have studied in physics or in your 10+2, right? So this depolarization waves, we consider those waves as vector, electrical vector, right? So these are electrical vector. Simply the depolarization wave, the flow of action potential, these are vector. They have got a magnitude and they have got a direction, right? So in heart, throughout the process of cardiac cycle, 5 different vectors with different direction and different magnitudes operates throughout the cardiac cycle. If you consider one single cardiac cycle of 0.8 second duration, so during this 0.8 second duration, systole plus diastole, right? Ventricular systole plus ventricular diastole, if you consider it 0.8 second, 0.3 second plus 0.5 second, right? So during this total 0.8 second duration of cardiac cycle, 5 different vectors with different direction and different magnitudes operates. And the function of an ECG machine is just to capture those vectors from outside, right? So let us take a simple example. The fast depolarization wave, which is starting from the SA node, which is usually located here in the right atria, right? So here is the location of SA node, right? And this is the point of generation of the depolarization wave, and the depolarization wave will move from SA node to AV node, which is located around here, right? So the direction of vector is this, right? Let's see. Fast vector. Okay. So this is the fast vector And the role of this vector is to depolarize the atria. So this is why it is called atrial depolarization vector. The first vector, I told you that, I'm sorry, it is automatically being forwarded. Okay, so this is atrial depolarization vector, right? Atrial depolarization vector. Truly, there is not a single vector. There is not a single vector. So if you consider this is your atria, right? And here is the location of SA node and here is the AV node, right? So what happens? So what happens from SA node, the depolarization wave travels in all direction, right? Depolarization wave travels in all direction. So in this direction, in this direction, in this direction, in this direction. So depolarization wave is traveling all direction, right? But as in a conduction tissues are present from SA node to AV node, we call it internodal tract, right? Conduction tissues are present between SA node and AV node, right? So here is the conduction tissues, SA node to AV node. So through this route, depolarization wave will travel faster, right? Why? Because say, assume that there is no conduction tissues. Conduction tissues nahi hai, right? So what will happen? One cell to another cell, one cell to another cell, in this way it will travel. Just like this is the left ventricle and here is the brick, here is another brick, here is another brick. So on one brick to another brick through gap junction, depolarization wave will travel, right? One brick to another brick, one brick to another brick, ऐसे करके पूरा ventricle will depolarize, right? But if you make a wire, so from this brick to this brick, it will travel faster, okay? If you use a copper wire, just like the wirings, okay? You are putting a switch over here and the fan is running, right? So we are taking the help of wirings. Similarly, in heart, there are conduction tissues, right? So conduction tissues are nothing but they are modified cardiac myocytes with densely packed gap junctions. That is why through the conduction tissues, depolarization wave travels faster, okay? So depolarization is traveling in all direction, but in this route it is faster, right? Because there is a specialized tract, there is wiring, and this specialized tract is internodal tract from SA node to AV node, correct? Okay. Now, if you add all these vectors according to definitely the law of physics, okay? You know, if you take any vector, a force, it has got force vector, it has got a cos theta f, right? And it has got a sin theta f, right? You know that, correct? So similar formula you can apply over here also. For the depolarization vectors, they have got a magnitude, they have got a direction. And if you sum all the vectors and you get a resultant vector, all the chote atrial vectors, so all these are small atrial vectors, right? All these are small atrial vectors. If you sum up, you get a resultant vector. And this resultant vector is this. Clear? So this is the resultant vector and this is also called the atrial depolarization vector, correct? So in the cardiac cycle of 0.8 second, I told you there are 5 vectors that operates sequentially, 1, 2, 3, 4, 5. Again, 1, 2, 3, 4, 5, right? So there will be 5 vectors, although their magnitude and their directions are not same. This one is the first vector or atrial depolarization vector. Come to the second vector. Second vector is the septal depolarization vector, right? Second vector is the septal depolarization vector. You see this? Septal means interventricular septum, right? Interventricular septum. Interventricular septum. So interventricular septum is depolarized from left to right. You see, this is the interventricular septum. This one is the interventricular septum. I have not drawn atria over here. You can see only the ventricle. This one is the right ventricle. This one is the left ventricle. This is left ventricular free wall. This is right ventricular free wall. And this one is the interventricular septum, right? It's a thick muscle, right? Okay. So this interventricular septum is depolarized from left to right. Again, it is needless to say, I have already explained that these vectors are resultant vectors. There are so many vectors that are operating in the interventricular septum, and the resultant of all those vectors are this. This is called the septal depolarization vector, which the purpose is to depolarize the interventricular septum. Okay. The first vector, its purpose was to depolarize the atria. राइट पहले पूरा हार्ट को डिपोलराइज करना है, नेक्स्ट पूरा हार्ट को फिर रिपोलराइज करना है, राइट? दिस इज द टारगेट, क्योंकि मुझे पहले हार्ट को कॉन्ट्रैक्ट कराना है, उसके बाद रिलैक्स कराना है, राइट? ड्यूरिंग दिस 0.8 सेकेंड कार्डियक साइकिल. क्लियर? ओके. नाउ दिस इज द सेप्टल डिपोलराइजेशन वेक्टर which depolarizes interventricular septum in a direction from left to right. Clear? Second vector. Third vector, depolarization of the cardiac apex. Depolarization of the cardiac apex, right? You see the direction of the vector. So depolarization of cardiac apex. Heart का जो apex है, that is depolarized by the apical vector. Okay? If you are drawing the pictures from this slide, although it is may not be required, I can share the slide later on. So if you are drawing the picture, remember one thing, that this length matters, right? Because these are vectors. It has got a magnitude, it has got a direction, right? The magnitude is its length, and the direction is definitely the direction of the arrow, right? So if you compare this depolarization vector for the cardiac apex or ventricular apex with the depolarization of the ventricular septum, directions are definitely different. Directions are definitely different, and the magnitude is also different. This is a small vector. Okay, this is a small vector which is required to depolarize the interventricular septum. But we need a much larger vector, much powerful vector to depolarize the ventricular apex. Why? Simply because of the muscle mass, right? Simply because of the muscle mass, because cardiac apex is a very thick muscle, cardiac muscle, right? In comparison to the ventricular septum. Okay? It is thinner. Okay. So again, coming to depolarization of the apex, this is the direction of the vector which is causing depolarization of the ventricular apex, which is the third vector. Now come to the fourth vector. Okay, actually ये जो fourth vector है, so there is no specific fourth vector. You see, this fourth vector, the sole purpose of the fourth vector is to depolarize the ventricular free wall. What do you mean by ventricular free wall? So this one is which ventricle? This one is which ventricle? Left. This one is left ventricle, right? So, and this one is right ventricle. And this is the left ventricular cavity. I have drawn only the ventricle. Here ऊपर में atria है, right? ऊपर में atria है, right? So this one is the ventricle only. Okay. So this is the left ventricular cavity and this is right ventricular cavity. And now this left ventricle has got a free wall, this is the free wall, and this is the interventricular septum is the attached wall, right? Okay, now the purpose of this fourth vector is to depolarize the ventricular free wall, and इसके लिए बहुत सारे छोटे-छोटे vectors हैं, right? So all the vectors just like a fanning out, right? All the vectors are fanning out from inside to outside, and it will depolarize the ventricular free wall. Correct? So all the छोटे vectors, they are depolarizing ventricular free wall, left ventricular free wall as well as right ventricular free wall. Okay. Now see, the vectors that are depolarizing right ventricular free wall, they are smaller than the small vectors which are depolarizing the left ventricular free wall. Why? Because left ventricular muscle mass is more than right ventricular muscle mass. Correct? This is hand-drawn picture. I mean, this should have been thinner. Okay. Anyways, this thickness is more. This thickness of left ventricular free wall is more than the right ventricular free wall. So it is quite obvious that if the muscle mass is more, you need stronger vector to depolarize, right? And this muscle mass or left ventricular muscle mass is more than the right ventricular muscle mass. Can you ask this simple question, why left ventricular muscle mass is more than right ventricular muscle mass? Yes, because left ventricle has to pump blood in the systemic circulation, and your right ventricle has to pump blood in the pulmonary circulation. Okay, left ventricle pumps blood in systemic circulation, which has got more resistance, right? And your right ventricle pumps blood into pulmonary circulation, into lungs, right? Which is a low resistance circuit. Your systemic circulation is a high resistance circuit, and your pulmonary circulation is a low resistance circuit, right? In the course of time, we can calculate the resistance at the pulmonary circulation, and we can also calculate the resistance at the systemic circulation, okay? In the unit of peripheral resistance unit, right? We will calculate it in subsequent time during discussing cardiac output, resistance, and all those things, hemodynamics, right? So if you see, systemic circulation resistance is much higher than pulmonary circular resistance, right? That is why your left ventricle has to overcome more resistance in comparison to your right ventricle, right? It's a simple rule. If you lift 20 kg dumbbell, you will get more biceps muscle mass. If you will lift 5 kg dumbbell, the muscle mass will be less, obviously, right? So simple rule, your left ventricle is working against more resistance. So it is getting hypertrophied, right? It is getting hypertrophied and left ventricular muscle mass is more, right? Okay. So to depolarize the left ventricle, you need stronger, vectors, right? Now all these small vectors which are depolarizing the right ventricular free wall and left ventricular free wall, they are operating simultaneously to depolarize all the left ventricular free walls, right? They are operating simultaneously, and you can see the small vectors which are depolarizing left ventricle and the small vectors which are depolarizing right ventricle, they are taking place in the opposite direction, right? They are taking place in the opposite direction. So now if you calculate and if you sum them up, add them up, right, you get a resultant vector here, right? Because these small vectors are more powerful than these vectors. So if you add these small vectors with this, you get a resultant vector which is directed towards left side, left ventricle. Clear? And this is the fourth vector, its direction is this. Okay? Now come to the final vector, fifth vector, which is the depolarization of posterobasal part of the heart. Okay? depolarization of the posterobasal part of the heart, and see the direction. Depolarization of the posterobasal part of heart. Okay. Now you need to practice drawing these vectors, and secondly, let's see all the vectors all together and complete a cardiac cycle. Not complete a cardiac cycle, we are completing a systole part at least. Okay. So first, atrial depolarization vector. Okay. If you take my heart, so suppose this is my heart, right? So this depolarization vector, it is in this direction. Clear? Okay. Atrial depolarization vector. Next, septal depolarization vector. The direction is this, in this direction, right? Okay. Now third is the depolarization of apex, and the direction is this, right? Now fourth, net ventricular depolarization vector, the direction is this, right? Now the fifth vector, which is the posterobasal part depolarization, direction is this. Clear? Okay. So this is happening in a sequence 1, 2, 3, 4, 5, right? Now check all the vectors, all the ventricular vectors. Okay, we are not considering the atrial vectors. So 2, 3, 4 and 5. Clear? So this is ventricle only. Atria का जो depolarization vector है उसको हम लोग छोड़ दिए, right? So 2, 3, 4, 5. Now you know another rule is, there is another rule, you know better than myself because you are just coming from physics chemistry background, right? So if there is one vector F, so this is vector F, you can shift it parallelly. I can draw this in this way as well. No change in direction, no change in magnitude, right? So now this 2, 3, 4, 5, all the ventricular vector, the first vector was atrial vector. ठीक है, उसको हम लोग छोड़ दिया अभी. We are not considering the atrial depolarization vector. So this is the septal vector 2, this is the apical vector, and this one is the ventricular free wall depolarization, and this one is the posterobasal part of the heart depolarization. Okay. Again I repeat, first vector was atrial vector, atrial depolarization vector. Second vector is septal depolarization vector. Third vector is apex depolarization vector. Fourth vector is ventricular free wall depolarization vector, and fifth vector is posterobasal part of the heart depolarization vector. Right? Clear? Remember these things. Okay. Now ये कोई भी vectors को आप parallelly move कर सकते हो. Right? This is force, one vector. इसको मैंने parallelly move कर दिया नीचे. Right? So there is no change in magnitude and no change in direction. Right? This is the rule of vector. Right? So now I will start all these vector from a single point. Okay. The center point of heart which is located, at the upper part of interventricular septum. Okay. And that point is this. This is the center part. So vector 2, vector 3, vector 4 and vector 5. आ जाओ भाई. Okay. ठीक है. So I have done nothing. Only I have started the vectors from a single point and I have moved them parallelly. ठीक है. Clear? So I have drawn all the vectors from a single point. Right? First vector यहाँ पर नहीं दिखाया गया है, right? First vector was the atrial depolarization vector. ठीक है? इसका direction शायद यहाँ पर कहीं पर होगा, right? The atrial depolarization vector. Okay? So 1, 2, 3, 4, 5, and your heart contracts. Again relaxation. Then उसके बाद again 1, 2, 3, 4, 5 contract. ठीक है? Relax. Then again 1, 2, 3, 4, 5. You need 1, 2, 3, 4, 5 for depolarization. ठीक है? You need 1, 2, 3, 4, 5 for depolarization. Now, what is ECG machine? Your ECG machine is nothing but a sensor which senses all those vectors. ठीक है? Your ECG machine is nothing but a sensor, voltage sensor. It detects the depolarization wave from the skin surface. Right? Okay. Now, what is the role of a sensor? Voltage sensor, right? So, it depends on where you have kept the sensor, right? Let me draw these 4 vectors over here. So, here is the center point, right? Vector 1, this is the atrial vector. Vector 1 को भी यहाँ पर draw करते हैं, right? So, vector 1 is the atrial depolarization vector, okay? Is the atrial depolarization vector. Then vector 2 is the septal depolarization vector, right? Then vector 3 is the vector for depolarization of cardiac apex, right? Vector 4 is the vector for depolarization of ventricular free wall, and vector 5 is the vector for posterior basal part of the heart depolarization. Okay? So, it is happening in a sequence, right? It is happening in a sequence. This, and contract. Okay? Now, you are detecting those vectors from outside with the help of a ECG machine, which is a sensor, and it depends on where you have kept the sensor. Okay? Now, consider I have kept a sensor over here. Right? I have kept a sensor over here. Okay. Now, what will happen? This is the first vector. First vector, second vector, third, fourth, and 5. Okay? So, I have kept a sensor over here. और ये किसी का heart है, right? This is someone's heart. Okay? And I have kept a sensor over here. So, first vector, सेंसर के तरफ आ रहा है या सेंसर से दूर जा रहा है? It is coming towards the center. So, it will give you a positive signal. Right? Now, second vector, सेंटर के तरफ जा रहा है कि सेंटर से दूर जा रहा है? सेंसर से दूर जा रहा है? दूर ही जा रहा है, right? If you extend it in this direction, it is going away. So, you get a negative signal. Correct? 3, सेंसर के तरफ आ रहा है कि सेंसर से दूर जा रहा है? सेंसर के तरफ आ रहा है, right? You get a huge positive signal. Because for all the vectors, this is the strongest vector. Okay? The stronger is the vector, the sensor will sense it loudly. Right? Okay. Third vector. Now, fourth vector, moving away. Right? If you extend it, it is moving away. Right? Okay. So, you get a negative signal. Right? Small negative signal. Now, last is the fifth vector. Okay. Actually, we do not get fifth vector wave separately. This 4 or 5 combined is this. Right? Okay. So, हो गया ECG signal ready? Right? So, you get ECG signal. Right? P, Q, R, S. What about T? यस, सो यहाँ पर हमें कितना मिला है? I've got a P, I've got a Q, I've got a R and S. Okay, for all the vectors what we have discussed, 1 2 3 4 5, for this 1 2 3 4 5 vector I am getting P Q R S, but in ECG signal we have a T as well, right? In ECG signal we have a T as well. What is T? Yes, once you have depolarized the ventricle, okay, and the ventricle has contracted, right? Now it's time to relax, right? Now it's time to relax. So you need to relax the ventricle. So for relaxation you need to do repolarization. Okay, you need to do repolarization. So ventricle is depolarized with 2 3 4 5 vectors. The ventricle is depolarized. Now it has to repolarized. It has to be repolarized, right? It has to be repolarized. Okay, right? ऐसे नोट से एक्शन पोटेंशियल निकला है, depolarization wave निकला है. Now it has depolarized the whole ventricle. Now it has to be repolarized. Come back to resting membrane potential, right? So to repolarize the ventricle, अच्छा पहले ये बताओ, depolarization wave travels from atria to ventricle or ventricle to atria? Depolarization wave, D, atria to ventricle, simply ऐसे नोट से start हुआ, then coming to ventricle, right? Okay, simply atria to ventricle. But repolarization wave, it travels in the opposite direction. Okay, repolarization wave, it travels in the opposite direction from ventricle to atria. It will repolarize, come back to resting membrane potential, मतलब relaxation, right? Now this sensor, okay, you have a sensor, right? You have a sensor. So one, say for example a depolarization wave traveling towards the sensor, depolarization wave, D, right? Depolarization wave traveling towards the sensor. The sensor will give you positive signal, right? Depolarization wave moving away from the sensor, negative signal. Repolarization wave, repolarization wave traveling towards the center, towards the sensor. What? Repolarization wave, negative signal. Okay, repolarization wave moving away from the sensor, positive signal. Clear? Okay, so T wave, it is positive wave or negative wave? In ECG, positive wave. It is due to repolarization. A repolarization wave which is moving away from the sensor, from the ventricle. ये आपका सेंसर कहाँ पर रखा हुआ है? This is your ventricle, right? And here is the atria, right? So आपका जो सेंसर है, it is kept towards ventricle, towards left ventricle. And I told you that repolarization wave, it travels from ventricle to atria. मतलब repolarization wave moving away from the sensor. Repolarization wave moving away from the sensor. You get a positive signal. You get a positive signal, T. Clear? So when depolarization wave travels towards the sensor, it will give you positive signal. When depolarization wave moving away from the sensor, it will give you negative signal. When repolarization wave moving towards the sensor, it will give you negative signal. And when repolarization wave moving away from the sensor, it will give you positive signal. ठीक है? मतलब repolarization wave moving away from the sensor is equivalent to depolarization wave moving towards the center, towards the sensor. Getting my point? Okay. So this is the basic mechanism of ECG, and the sensor here is basically the lead 2. Okay, sensor here is lead 2. In ECG, we use multiple leads simultaneously, and those leads are lead 1, lead 2, lead 3, lead AVR, AVF, AVL, and the chest leads from V1 to V6, right? So let me write the name of the leads. Lead 1, 2, 3, AVR, AVL, AVF, then V1, V2, V3, V4, V5 and V6. These are conventional 12 lead ECG. Okay, और अभी मैंने जो example दिया आपको for with the sensor, this sensor is basically the location of lead 2, right? Location of lead 2. Okay. Now, before I enter into complete ECG setup and direction of all leads, we need to define what is a lead and what is electrode, right? Okay. A lead is defined as a pair of electrode, okay, to measure the potential difference between 2 points, say for example point A and point B, point A and point B, right? And you need to, here the potential is VA and the potential is VV, and you want the difference between this difference of potential between these 2 points. So del V is equal to VA minus VV. So to do this, you need 2 electrodes, right? So one electrode here, and connect them in between with a voltmeter. Clear? Simple. So this is a lead. This is the definition of a lead. In electrophysiology and all the electrophysiological tests, diagnostic tests, like most important is ECG, electrocardiograph, then EEG, electroencephalogram, right? The electrical activity of brain, electroencephalogram, and what else? The nerve conduction studies, right? Evoked potential, brainstem evoked response potential, right? Evoked response audiometry. So all this, for all these electrophysiological diagnostic tests, we use leads. And now we are discussing ECG. So ECG leads, right? So for any electrophysiological diagnostic test, we use leads, and leads are defined as a pair of electrode and a voltmeter in between. Two electrode and a voltmeter, okay? Collectively they are called a lead. And in an ECG machine, we have all these 6 leads, all these 12 leads, 1, 2, 3, AVR, AVL, AVF, and V1 to V6, all these are chest leads. Clear? Okay. Now, say this. In ECG, you have a graph paper, right? Okay, before coming to the graph, the approximate angles of the cardiac vectors. Okay, by now I guess you are all remembering all the 5 vectors. Number 1, the atrial depolarization vector. Number 2, septal depolarization vector. Number 3, apical depolarization vector. Number 4, ventricular free wall depolarization vector. And number 5 is the posterobasal part depolarization vector. So all these vectors are happening not simultaneously, one by one, 1, 2, 3, 4, 5, okay, in a different direction. So more or less the angles of all those vectors lead vector 2 or specifically the ventricular vectors, okay, the ventricular vectors, vector 2, the ventricular vector, which is the this one, which is the septal depolarization vector. It operates at an angle of 170 degree, approximately 170 degree, because no angles are fixed hard and fast, right? Because there is a specific range. Okay, so 3 is approximately at 70 degree, 4 is approximately minus 10 degree, and 5 is approximately minus 70 degree, right? Okay, and the calculation of angles, there is a convention. This is 0 degree, okay, this is 0 degree, and in this way it rotates in a negative direction. This is minus 30 degree, this is plus 30 degree, this is plus 90 degree, this is minus 90 degree, right? This is plus 120 degree, and this is minus 120 degree, this is minus 150. Clear? So starting from 0, this is the positive direction. From 0, this is the positive direction. From 0, this is negative direction. Okay. So see all these vectors graphically here. So fast vector यहाँ पर दिखाया गया नहीं है, right? So fast vector is not present here, the atrial vector. So we are considering the ventricular vectors over here. So 2, it is around, see, 170 degree, right? 170 degree. Then 4 is minus 10 degree, right? 3 is, see, 70 degree, right? And 5 is minus 70 degree. Correct? Okay. Now, you can see one green color vector over here. 2, 3, 4, 5, all the ventricular vectors, and you see a green color vector. What is that vector? Right? This green color vector is called mean electrical ventricular vector. Mean electrical ventricular vector, or mean electrical vector, simply mean electrical vector. Matlab, now you are summing up 2, 3, 4 and 5, 2, 3, 4 and 5. You are summing up and you are getting a resultant, okay, and you are getting a mean electrical vector for your ventricle. You are getting a mean electrical vector for your ventricle, and this mean electrical vector, direction of this mean electrical vector is called the cardiac axis. Okay, the direction of this mean electrical vector is called the cardiac axis, and which is a very important parameter while interpreting an ECG. जब भी आप कोई पेशेंट का ECG देखोगे तो फर्स्ट हमें क्या देखना होता है? हार्ट रेट देखना होता है, रेट, रिदम, whether the wave is coming from SA node or not, sinus rhythm or not, and next 3 नंबर पॉइंट में हमें जो देखना पड़ता है, that is cardiac axis. Okay, and here you see the cardiac axis around 40 degree or somewhere like that, right? Okay, and the normal cardiac axis is located from minus 10 to plus 110. Okay, in some books it is written as 0 to plus 110. No issues, whatever book you are studying, you can remember that, right? So that means if this vector, green color vector or mean electrical vector, it rotates in a positive direction, and it crosses 110 degree, right? Then we call it right axis deviation. We call it right axis deviation, right? And when this green color vector, it shifts or rotates towards negative angles, right? We call it left axis deviation. Okay, right axis deviation and left axis deviation. You need to remember what is mean electrical vector, what is the normal location of main electrical vector, right? The range, what is right axis deviation, what is left axis deviation. And when you will be able to interpret an ECG, you will be asked what are the causes of right axis deviation and what are the causes of left axis deviation. Okay. So right now, for now, you can remember right axis deviation, it happens in bundle branch block, right bundle branch block specifically, right? And left axis deviation, it happens in left ventricular hypertrophy. Okay. Right axis deviation, it happens in right ventricular hypertrophy as well, right ventricular hypertrophy. And left axis deviation, it happens in left anterior hemiblock and left ventricular hypertrophy as well, right? We will discuss all those things during interpreting specific ECG. So before that, we need to interpret normal ECG, then we need to interpret diseased ECG as well, right? Okay, so we will discuss one by one. First, we need to know all the leads carefully, right? All the 12 ECG leads, how they are formed, the formation of those leads, and what are the different signals in different types of leads, because in this class we have already, we have only explained the ECG signal which usually we get in a healthy heart in lead 2, right? So similarly, we will explain all the ECG waves in all the leads, right? And we will understand a normal ECG first. Then we will discuss other ECGs in a disease condition, right? So we will discuss what are the disease conditions that you need to know. So blocks, first AV blocks, right? AV blocks, then arrhythmia, different types of rhythm disturbances, and finally the ECG changes in myocardial infarction, heart attack, right? So how to identify those things, an arrhythmia or myocardial infarction or AV block from an ECG, okay? So it will take time, it will take much number of classes. So even normal ECG is not complete yet. So first we will complete the normal ECG, interpretation of normal ECG, then we will move towards the ECGs in diseased condition, right?